Hello, Kin 60 Tenors. Welcome to your online lecture or navigation through the template for the critical appraisal topic paper. Please note that the critical appraisal topic paper is the culminating project in this class. So at the end of 8 weeks, you will turn in a critical appraisal topic. With that said, I didn't want to wait until later in the class to at least introduce you to this template, to at least talk about the project and the expectations of the project. So I'm doing that very early on so that you can understand the importance of the paper that you are turning in. For the Masters of Science in Athletic Training students, this will be your culminating project at the end of year 2. So I recommend that you really pour into this project now so that we don't have to change the entire document when we get into year 2 of the program. So focus, finding a topic that's important to you right away, and writing really well in this particular class will only be helpful to you throughout the next 3 semesters of the program. For MS Kenners, students taking this class, this paper becomes a paper that you can use for your capstone project. So again, whether you're an MSATer, whether you're an MS Kenner, pouring into this project now will only mean less work in the future semesters to come. So with that said, this template was created intentionally. This template was designed based on the standards for publication through the Journal of Sports Rehabilitation. So in an ideal world, students will not manipulate, will not alter, will not change this template. They will just kind of type where they need to type. So with that said, let's go through the template so that we are clear on the expectations and what items will go into each category. So the title, I think, is pretty straightforward. You're going to put the title of your critical appraisal topic in this section right here entitled title. Recommendations for publication is that a title wouldn't be more than 30 to 40 words in length. Some publications actually want you to do less than that. So depending on where you are, the moral of the story is be concise with your title. Your title should be something that reflects the critical appraisal topic that you are writing on. In this particular class, we will go through each of the titles and tweak them as we go so that you have a final top title by the time you get to the final project in this class. I think the next section is pretty straightforward. It's the author name and credentials. So in this case, I would be Nicole Cosby, and my credentials would be PhD ATC. Some of you may be CS. When you graduate from either the MSAT or the MS Kin, you're going to have either MS, ATC, or you might have MS, CSCS, or personal trainer, which would be P.T. So you're going to put your credentials there. Most of you, if you submit for publication before you graduate, then your affiliation is going to be Point Loma Nazarene University because that's where you wrote the paper. However, when you graduate and you get hired and you work for another company, if you submit the paper while you're working for that company's name should go into the affiliation bar. The address is just going to be that. It's where you want your copies of your publication to go or to be sent. Your phone number most often is going to be the cell phone. And this is important because as they start getting into the technical pieces of your paper, the tech writer might call you and ask for clarification on a point. Some of you may not have a fax machine. If that is the case, then I recommend just putting Point Loma's fax machine and we can send you documents. But typically publishers will fax over pages for the author to sign. And then last but not least, your email. Now, most of us have a Point Loma email, right? I don't know if you all know this, but your Point Loma email will essentially transition into a Gmail. So you don't have to use your Point Loma email, but do know that you'll have it for a lifetime. Once you're done with that section, then we get into the actual paper itself. Now you'll see these kind of gray subheadings as you go. Please do not type in the actual gray subheading. You're going to type underneath the gray subheading. So the first section that you get to in a critical appraisal topic is what the critical appraisal topic paper calls the clinical scenario. But most of us know this as just the introduction, right? And I'm going to show you examples within the class of the introduction. But in a critical appraisal topic, the introduction is actually relatively shorter than a traditional manuscript. So you're looking at 2 to 3 short paragraphs introducing the need for the actual topic that you chose. And again, we'll go through some examples so you can see just how short and brief the clinical scenario or introduction is. So again, please do not write in the gray section. Please type in the white section beneath it. The next section is going to be the focus clinical question, and this is essentially going to be the PICO. And many of you, if you're watching this before we've even gotten into the PICO question, you're going to be a little bit confused. But this is where you're actually going to type in your clinical question that you want to have answered by the time you finish this project. So your clinical question or your PICO will go in this section. The summary of the best research or best evidence appraised and key findings is just that. It's bullet pointed, which is why I have bullet points here. And the focus is really in this section is really on 2 to 4 key points that you found in the studies that you included in the critical appraisal topic. So an example of this would be: studies have concluded that fear of re-injury is a unique predictor to patients who have ACL injury. So you're going to just find 3 key facts from all 3 studies, and you're going to put them in the summary of your best evidence. Now, these are bullet pointed, which means they shouldn't be in paragraph form. They're short, they're concise, maybe a sentence or 2, and then that's it. The next thing that you're going to do is you're actually going to look at the clinical bottom line. And the clinical bottom line is exactly that, as it describes. It's what is your recommendation to clinicians who are reading this research manuscript. So an example of a clinical bottom line is in patients with ankle sprain, in those doing balance rehab programs have less recurrent ankle sprains following a proprioceptive training. That's a clinical bottom line. I can use that in the clinical setting. Your strength of recommendation is going to be done using the consort flowchart, and again, we'll go through that. But you're actually going to grade the 3 research articles that you have in your critical appraisal topic. So you can give them an A through a C in terms of the grade, and the grade or the strength of recommendation kind of tells clinician how serious should they actually take what you found. So is it something that they should use to change clinical practice, or if it's a C, then it's like, I'll read it, I'll take it for a suggestion, but I'm not going to use it in the clinical practice. For the search strategy section, again, you're going to take exactly what is here, so don't alter. And you're going to say, okay, in the patient client group, what search terms did I use? So example would be ACL patients, ACLR patients, patients with, I don't know, let's say cardiomyopathy. The list could go on, right? In the intervention, it could be something like rehab, jump landing, different types of drugs that they could take, right? And then you're always going to have the comparison group. So if we had ACL, then maybe we had healthy individuals, right? And then the outcomes are important. The outcomes kind of tell us what we're actually looking at. So in an ACL patient, it might be improvement in landing technique. It could be strength gains. It could be reduction in blood pressure for a cardiomyopic patient. It could be all kinds of different things, but you get my point, right? So what you want to do is put the search terms that you used, so that if I were to pick up this paper, I could kind of use the same search terms and find the same research articles. Your sources of evidence are what databases you use. I think by the time you finish this class, you'll use more than Google Scholar, but Google Scholar seems to be a popular choice. You could use PubMed, right? I'm just giving examples here. Cochrane database is also a good one. But so you'll have different databases that you use to search for research articles and find them. And so you're going to list those there. And that's pretty simple. Again, it's bulleted for a reason, to keep it short, to keep it concise. Next are the inclusion-exclusion criteria. So what criteria did you use to decide whether or not a research article was included in your critical appraisal topic? So that could be, they had to all be in English, right? So if you don't speak another language, then an inclusion criteria would be that they all had to be in English. We could talk about age as a factor. So patients had to be between the ages of 18 and 30. The different inclusion criteria, you'll have to decide that as you search the research literature and determine what research articles are actually going to be included in your critical appraisal topic. For exclusion criteria, An example of this would be in the ACL research, it would be no patients could have hamstring graft, right? Does that make sense? For ankle sprain patients, it could have been something like no injury within the last 6 months, right? So you'll work with me or any other professor of the course to determine what your inclusion and exclusion criteria might be. Now, there are 4 bullet points, but that doesn't mean that you have to have 4 inclusion and 4 exclusion criteria. So feel free to delete any bullet points that you don't use to kind of clean up the document. So here's where the fun kind of begins a little bit. But what you want to do in these 2 tables that we're going to talk about is really put in all of the information in the CAP. This is probably where you'll spend the majority of your time in your critical appraisal topic. So the first table is a summary of the study designs of the articles that were retrieved. So you're going to give them a level of evidence, and again, we'll talk about what that means. You're going to decide what type of study you're using. Is it a randomized control trial? Is it a cohort study? Is it a retrospective study? And then once you decide what type of study it is, then we have to figure out, okay, how many articles that you've included are randomized control trials, are retrospective, and then you're going to put the author's name and the year. So this one's pretty simple. It's pretty straightforward. Typically, you don't need more than 3 to 5 of these rows, but I've added more just in case. So once you've determined the studies that you're going to use in the critical appraisal topic, then there's best evidence. You're going to have to provide justification to the reader as to why you chose the 3 to 5 research studies. So it's going to be 3 short sentences on why each of the studies included in your CAT should be included in your CAT. Last but not least is the summary of best evidence, and this is a pretty long and robust table. You're going to basically include any characteristics of the studies that you are including in your critical appraisal topic. So the first thing is going to be looking at how the table is actually set up, right? So you want the title of your study to go here along with author and year in the columns, and in the rows what we're going to do is add all of the information from the study. So as you did in table 1, you're just going to list the study design for each of the research studies included, and then you're going to get specific about the types of participants in each of the study. This area should include the number of participants in each group. It should include the mean and standard deviation for age of participants in this group. So this is where we learn which kind of patients were actually included in the study. In the intervention investigated, this assumes, number 1, that you have an intervention study. If you don't, just ignore it. But if you do have an intervention study, so they're doing some type of treatment, they're doing some type of rehab, you need to tell us what that intervention was. 6 weeks of a quad strengthening program, 7 weeks of oral medication. You have to tell us what that was, and hopefully what you'll see, ideally what you'll see, is that the intervention investigated is consistent across all of the studies that you're using in your critical appraisal topic. I think the area that most students really drop the ball on is the outcome measure or outcome measures. These are essentially your what are called dependent variables. In other words, this is what the authors wanted to see would either improve or decline after they did the intervention, right? So examples of outcome measures could very well include strength of something, right? It could very well include increases in range of motion. It could also be pain as a factor. The list could go on. What you want to do is just simply list those there. So what are the outcome measures? Now, here's where it gets tricky in a critical appraisal topic. In order to have a good critical appraisal topic, in order to really score relatively high on this particular assignment, you have to have a consistent outcome measure across all 3 studies. So an example would be if study 1 includes strength of something, then study 2 should include the same strength of, right? So strength of quads, and this one should also include strength of quads. So example, guys, if you don't have a study, all 3 studies that share an outcome measure, then you cannot have a critical appraisal topic. Hopefully that's clear. Okay, The main findings are the actual results. So example would be strength decreased in the ACLR group, but improved in the healthy group. Levels of evidence we'll get into later in the class, and then you're going to appraise all of these articles and you're going to give them a score. So again, these two topics, they'll become clear once you have the actual lecture on them. And then last but not least, based on the results and the findings, what are your conclusions? So please don't copy and paste the conclusion from the research articles. You actually draw a conclusion based on what you read, and you put that in the conclusion box. If that was a lot to take in, then you can look down here at the different descriptions to help you kind of navigate what's supposed to go where. Essentially, when you turn in your document, though, what I would like is for you to delete this component, because this is just there to help guide you as you're writing your document. The next section is the most important section. It's the implications for practice, education, and future research. So this is where you're going to say to the reader, what did the 3 studies tell us, right? So you're synthesizing the 3 studies, but then most importantly, how can they use this in their clinical practice, or even can they? So you're going to make suggestions on how this should be implemented into their clinical practice. And then always at the end of a critical appraisal topic, you're going to talk about ways that we could further the research that was done. So an example would be you find that there was an improvement in strength gains. So then the research needs to look at different exercises that might improve strength gains in patients after an ACL reconstructive surgery. I hope this was helpful. The idea is that your CAP wouldn't be any more than 10 pages, double spaced and typed. Sometimes it's a little bit longer, but the reality is to get published, it has to be less than. So I'm hoping that this is encouraging. The maximum number of pages that I've ever had a student turn in is 7, and that's really ideal. Okay, we do have rubrics inserted into the class to guide you as you write, so that you have a great understanding of how you're being graded, because this is such an important assignment. So again, thank you for listening. Please let me know if you have any questions regarding the critical appraisal topic that'll be due in a few weeks.